Dr. Barnett's your board certified psychiatrist. If you're watching this, you're either a student that's rotating with me or you are an enthusiast on this topic. Either way, I'm happy that you're here. I love you all. And today we're going to learn about lithium. Here we go. I have a mnemonic, elemental PGI skin. I know it rolls right off the tongue. L is for lithium. Love when that happens. Okay, M. M is for muscle tremor. Okay? This is a fine tremor. Don't memorize buzzwords, but remember that a resting tremor is with Parkinson's disease, and there's an essential tremor is different. There's an intention tremor that's like when you grab something that's usually cerebellum or similar. This is a fine tremor that's usually kind of very small, fine tremor, but as lithium toxicity goes up, it'll get worse. N. N is for nephrogenic diabetes insipidus. Nephrogenic diabetes insipidus. Okay, now what is this? Insipidus means like secret kind of. So this has nothing to do with glucose. It's called diabetes because they get polyuria and polydipsia. What happens? Antidiuretic hormone is secreted from the pituitary gland. Normally it goes to the kidneys and it connects to the receptors there and it antidiuretics, right? It helps you keep water, essentially. In this, the kidneys kind of injure the receptors at the kidney level, hence nephrogenic. And when ADH goes to the kidney, it cannot bind to the receptor, and essentially it's almost like ADH doesn't work and you don't have ADH. So you can't antidiuretic, and therefore you urinate too much. And that's why you get polyuria, polydipsia, and that's why it's called diabetes, because it presents like that. So you should be aware of that. Usually when this happens, you're going to lower the dose or change the medication generally if this doesn't get better. Oh, I'm gonna do a little sneaky business here. Hypothyroidism. See what I did there? Hypothyroidism. I got this, by the way, from a old textbook in medical school, and then I added to it and I kind of made it better. So hypothyroidism. Okay, this is direct injury to the thyroid, essentially. This can be easily treated in somebody that really needs the medication, which is an important point to understand. That you could do a thorough risk-benefit ratio here. If you give somebody lithium and it keeps them out of the hospital, it keeps them alive, let's say, it keeps them safe, let's say, but in return you get a hypothyroidism, you could potentially just treat the hypothyroidism. As you all know, thyroidism is actually very simple to treat. So something that has to be monitored. P. P is for pregnancy problems. You really want to avoid lithium in pregnancy. Really, you shouldn't use it in somebody who wants to get pregnant. It causes something called Epstein's anomaly. Epstein's anomaly. And what that is when the tricuspid valve is embedded in the apex of the ventricle, basically. So you get what's called, in cardiology world, they call it atrialization of the ventricle, which means like the whole side of the heart, the whole one side of the heart becomes the atrium, essentially. And it's not compatible with life, usually. So very problematic, obviously. GI is nausea, vomiting, diarrhea, abdominal pain. Not constipation. I want students to understand that there is an osmotic property here to lithium, and that it would not cause constipation generally. Skin. It'll worsen any skin condition. You know, skin is the integumentary system, so skin, hair, nails. You could think psoriasis, acne, seborrheic keratosis, pemphigus vulgaris, anything, sunburn, photosensitivity, anything skin related, lithium kind of accentuates and makes it worse. And to end it off, I wouldn't be doing you any justice if I didn't mention how good lithium is. It's probably the gold standard in bipolar disorder. It is the best medication you can give somebody if you really wanted a mood stabilizer that works. It is the most anti-suicidal medication in our arsenal. There's multiple clinical trials that prove that lithium can decrease somebody's suicide risk. It also is a mood stabilizer that can be very good at treating mania and really low depression. That's kind of like asking a medicine to be an upper and a downer at the same time. So I want folks to realize that this is a higher risk, high reward medication, but most of our patients may not require a medication like this, but when you do, it really can be life-changing.